Years, we've told you about the health care crisis our Commonwealth is facing. Hundreds of thousands of Pennsylvanians living in areas with no medical professionals. State lawmakers think they have a fix, but there is resistance at the Capitol. Sarah Wilson joins us live with the story. Sarah?
Dennis, this is legislation two nurse practitioners say could be a game changer for access to health care, but there are doctors and major medical groups who are pushing back.
Nurse practitioners provide high quality.
Joyce Nestrick has been a nurse practitioner for over 30 years. Many were spent here in Pennsylvania until
my practice partner decided to retire, and that's why I'm not there anymore.
Now she's in West Virginia, a state where she can run her own practice. She couldn't in Pennsylvania.
We're limited by this collaborative agreement,
which are basically contracts with physicians that a nurse practitioner or an organization has to pay between $1,000 and $2,000 a month.
Representative Khan is also a nurse practitioner. He says that money goes to the physician.
So this is a physician that will never see the patient, will never look at the patient's chart.
And that's part of why he and other nurse practitioners believe the collaborative agreement is unwanted and not needed.
We're able to assess, diagnose, order tests, order screening, and treat patients.
27 states and Washington, D.C. allow nurse practitioners to work without a doctor. House Bill 1825 would allow Pennsylvania to. But groups, including the American Medical Association, are fighting this, saying that patients deserve care led by physicians, the most highly educated, trained, and skilled healthcare professionals, and that it vigorously defends the scope of practice expansions.
I don't think there's any premise to what they're saying.
Nestrick and Khan argue getting rid of the agreement could drastically expand access to health care.
We see that nurse practitioners actually are more likely to move into rural areas and areas that are underserved.
And I did reach out to the American Medical Association, who you saw that statement from. They tell me they do not comment on specific legislation. Dennis?
Sarah, thank you very much.